1, 2, 3. Okay, so my persuasive speech. Today, I'm going to talk about vaccines for dogs. We all love our dogs, right? Part of loving our dogs is wanting them to be healthy. And a big part of wanting them to be healthy is to get them vaccinated. Dogs need vaccines for multiple reasons. They need them because they come in contact with diseases in the environment. They come in contact with diseases that other dogs have. And even you can bring home diseases on your clothes if you come in contact with an infected dog. So there's two sections. There's core vaccines and there's non-core vaccines. The core vaccines, the first one, by law, every dog has to have a rabies vaccine. Depending on what county you live in, there's a 1-year vaccine that lasts for 1 year. There's also a rabies vaccine that lasts for 3 years. Obviously, the 3 years one is better because we don't like to inject our dogs with chemicals unnecessarily. The next core vaccine is a distemper parvo vaccine. Now that's what we call it, but there's actually, depending on what brand you use, there's multiple strains inside that one vaccine. So it will cover the distemper vaccine, covers adenovirus, it covers parvovirus, and it covers parainfluenza. The last vaccine it's technically core, but not required in all dogs, is the Bordetella or the kennel cough vaccine. Dogs who are boarding, grooming, going to doggy daycare, or they go into contact with other dogs need that Bordetella vaccine to protect them from kennel cough. Now our non-core vaccines, the first one is going to be the leptospirosis vaccine. That one is a non-core because not every environment has leptospirosis in it. And in a lot of cases, the leptospirosis causes the most vaccine reactions, which is facial swelling, vomiting, and the vaccine reaction is worse than them potentially getting the disease or not. Another non-core vaccine is the Giardia vaccine. That one, if dogs do end up getting Giardia, the treatment is almost nothing. We'll cover that later in the speech as well. So that one is kind of obsolete. Coronavirus is a puppy disease that is also obsolete. We don't use it a whole lot because the treatment is easier than the vaccine on the body. The fourth non-core, it's non-core but it's becoming highly recommended. It's for canine influenza. Now the recent outbreaks in Chicago and in Houston, if a dog's going to boarding or dog shows, we're recommending it because canine influenza, like Bordetella, is very contagious. Now distemper is a neurologic systemic disease. It occurs in puppies and in dogs. The symptoms are high fever, vomiting, diarrhea, lethargy, eye discharge, nasal discharge, and in severe cases, seizures. Now, with puppies, if they get distemper, they will also have, their teeth won't form correctly and they'll have stunted teeth. There is no treatment for distemper as of right now. You're treating the secondary infection, the vomiting, the diarrhea, the lethargy. So the vaccine obviously is a very good alternative to treatment. And in some cases, say your dog gets the seizures part of the disease, that is a lifelong medication that they will have to be on. Parvovirus is a disease that puppies get. It can occur in dogs, but it's a lot less likely. All they have to do is come in contact with the environment where a parvo dog has been lately, or with a puppy who has parvo as well. The symptoms are high fever, vomiting, diarrhea, lethargy. There's also no treatment for parvo, no cure. All we're doing is we're going to treat the symptoms of vomiting, diarrhea, and we're going to do intravenous fluids because they will get dehydrated really quickly. Bordetella. Bordetella is also called kennel cough. Causes coughing. In severe cases, it can cause pneumonia. The treatment's really simple. It's antibiotics and a cough suppressant. Now, our rabies. Rabies is a neurologic disease. They get that from an infected saliva from bats, coyotes, foxes, and other dogs mainly. Once they're infected with dogs, it takes between 3 to 8 weeks to start showing symptoms. There's 3 phases of symptoms. The first phase, they'll start getting nervous and anxious. The second phase is when they get aggressive. That is when they're most likely to spread the virus by biting other people. And the third is when they get labored breathing and go into respiratory failure. and there is no cure at all for rabies. Now our non-core infections. Giardia is a parasitic cyst that is around in stagnant water. If your dog drinks the stagnant water, they can get that. That one is transmissible to humans, so only if you come in contact with infected stool. The treatment for that is an antiparasitic and some stool hardener. The next one, leptospirosis, is a disease that causes renal failure in dogs. The way they get it is by drinking urine from an infected animal, such as a squirrel or a rat. This one's also transmissible to humans, but only through infected urine. The treatment for that one is some strong antibiotics and intravenous fluids to flush out their system. Coronavirus. Essentially the same treatment as parvovirus, some intravenous fluids and treatment for nausea and diarrhea. And then our last one is influenza. Now, influenza is a lot like Bordetella, except the symptoms can vary from asymptomatic, where they don't have any symptoms at all, but they can still shed it and carry it, or they have severe pneumonia and they're in an oxygen tank. The treatment for that is essentially the same as Bordetella, a cough suppressant and an antibiotic. Now, all those vaccines are it's a lot to take in. Every dog's needs are different as to what vaccines they need. If your area does not have leptospirosis, if your dog doesn't go to boarding or grooming, there's no need to give those vaccines, especially if they're not exposed to it. We don't want to give them extra vaccines. Now, if you have a dog who has cancer, lymphoma, you don't want to give them any vaccines because they're already immunosuppressed. So they don't get vaccines, whereas a healthy 2-year-old dog who goes to grooming needs all the core vaccines. And if they have other diseases in their area, there's other vaccines for that as well.